allowing free movement. This bridge is called the clavicle. Where the clavicle begins, the medial sternal end. At the center of your chest, the clavicle starts as a thick, strong end. This is the sternal end. It joins the manubrium of the sternum, forming the sternoclavicular joint, the only bony connection between the upper limb and the trunk. This end is bulky and quadrangular because it carries a lot of weight and force from the arm. Just below it, the clavicle also touches the first rib through its cartilage, adding extra stability. Moving along the shaft, the curved Mittelmeniscent. As you move outward from the chest, the clavicle becomes slimmer and gently curved. When seen from above, it forms an S shape. The medial 2/3 curve forward, convex anteriorly. The lateral 1/3 curves backward, concave anteriorly. This shape is very important. It allows the clavicle to bend slightly when force passes through it, acting like a spring. The upper side, superior surface. The top surface of the clavicle is smooth and lies just under the skin. That's why you can easily palpate your collarbone. Because it is smooth, it has few muscle attachments. The lower side, inferior surface. The underside of the clavicle is rough because many important structures attach here. Near the center is the subclavian groove, where the subclavius muscle lies. Closer to the sternal end is the costal tuberosity, where the costoclavicular ligament anchors the clavicle to the first rib. Near the shoulder end are the conoid tubercle, the trapezoid line. These give attachment to strong ligaments that tie the clavicle firmly to the scapula, preventing the shoulder from dropping. The borders, edges, of the clavicle. The clavicle has two borders running along its length. The anterior border gives attachment to pectoralis major near the chest, deltoid near the shoulder. The posterior border gives attachment to sternocleidomastoid near the chest, trapezius near the shoulder. These muscles pull from different directions, keeping the clavicle stable during movement. Reaching the end, the lateral acromial end. At the shoulder, the clavicle ends as a flat, thin piece of bone called the acromial end. It meets the acromion of the scapula, forming the acromioclavicular joint. This end allows smooth shoulder movement, but is more delicate, which is why injuries often occur here. Why the clavicle is so important? Because of the clavicle. The shoulder stays away from the chest. The arm can move freely. Shock from the arm is absorbed. Blood vessels and nerves underneath are protected. In simple words, open quote, the clavicle is a protective, supportive strut that connects the arm to the body. Close quote. One-line exam summary. Open quote. The clavicle is an S-shaped long bone with two ends, two surfaces, and two borders, acting as a strut between the sternum and scapula to support and protect the shoulder. Close quote. If you want next, why clavicle fractures occur at the junction of medial 2/3 and lateral 1/3. Memory trick